To all of our attendees, welcome. My name is Dan Sullivan. I am the head of partnerships at Cuseum. I'm going to be your moderator today. We've got a great conversation about reopening and the action plans around that. So if you're new to Zoom, feel free, first of all, to introduce yourself in the chat. You'll see that in the bottom bar of your Zoom window, and you can pop that chat box out on the right side so you can converse with the other folks that are watching today. We're expecting around 300 people, so again, feel free to introduce yourselves. They're going to be a great resource as we have this ongoing conversation. Secondly, there's a Q&A functionality through Zoom, which you might already be familiar with, but if you're not, hit the little QA button and you can ask a question. If you see a question that you like, you can hit the little thumbs up and upvote that. That will push those questions up to the top, which will allow us to ask them to our different panelists. So again, thank you all for being here. We're excited to have this conversation. With that, I'm going to send it over to Lizzie Moriarty from Cultural Innovations.
Hi everybody, and thanks for joining. I just wanted to sort of kick off by saying, we can't reinvent the wheel, so we're all here to learn from each other. And this pandemic has taken a lot away from us, but it has also given us the impetus to do new things in different ways. And it's thanks to Dan and Brendan at Cuseum for hosting this seminar that we can speak across continents and learn from each other's differences and similarities and ways of working. So it's a chance to exchange experience between US and Europe. And thank you also to Charity for leading on this. And I hope we'll do more of these as events unfold and we start to look at the longer term implications, because there are many. And just remember one thing that is taught to British Army officers in their training: no plan survives contact with the enemy. So that means that we really do need to be prepared for the unexpected, and your roadmap needs to be flexible. M+ in Hong Kong, which hasn't opened yet, it's a new museum, it's still in development. And because of this pandemic, they are on version 27 of their operating plan as they're learning from museums around the world. So we have benefits of the pandemic, very few, but this is one of them. We can all get together in forums like this. So that's why we're here today. And so over to learn.
Absolutely. And Charity, do you want to share a few words?
Yes. My plan for today was to simply say thank you to Cuseum and to Dan for hosting and moderating today. We really appreciate your participation and support of this new series. I think this is an important conversation, but I would be remiss if I didn't use this opportunity to address something that's very important and happening right now in the United States. I'd like to express that, for all of our museum professionals listening in and on this panel today, that if the events from this past week in the US and an acknowledgement of racism as a public health issue has taught us anything, it's that we cannot return to business as normal whenever we do reopen, and to keep that in mind when you are. I also want to take a moment to urge the leaders and the managers, everybody who's listening in today, to make sure that they're giving space to their Black and African American employees and colleagues to grieve, to deal with the stress and anxiety of right now. I think it's incredibly important that we give them space. Anyway, I just wanted to be able to say that to all of you. I think I'm looking forward to learning from everyone today, and all of you listening in, and wish you the very best with your reopening plans. So with that, I'll pass the mic back to Dan.
Awesome, and thank you again for having me, and definitely want to also acknowledge the fact that these are some very heavy times for us here in the US, so I think that can't go without being stated. So I'm going to pass it over to Zinnia for a couple opening remarks.
Sure, thank you, and I also echo Charity's words, Dan's words. Thank you to everybody for your support. My name is Zinnia Willits. I am the Executive Director of the Southeastern Museums Conference. I'm a new director. I've been in this job for exactly a month. So it's been sort of an interesting time period to transition jobs, to say the least. But I'm really excited to be part of our Southeast Museum community and to be able to partner with our colleagues on important discussions like this. I did just come from a museum. I worked for 17 years at the Gibbs Museum of Art in Charleston, South Carolina, and they just reopened last week. So while I'm now in a new realm, I just went through this as a museum professional. So I'm really looking forward to this panel today. And thank you to all of our panelists. I know how much work additional work goes into preparing a presentation like this. We're all doing extra, doing more, and I'm very appreciative of Sabrina, Michael, Patricia, and Cecilia for taking their time today. So with that, let's get going, ready to do it. Thank you, Dan. Thank you, Charity. Thank you, Lizzie.
Absolutely. Well, again, thank you for sharing a bit. So we're going to kind of go around the room a little bit here and have our different panelists introduce themselves. So I'm gonna send this over to Patricia. If you can, take 5 minutes or so, talk a little bit about where you are in the process of reopening, a bit of background on your organization. I think that would be a great starting point to give our audience an opportunity to kind of understand the different folks who are in the room. So with that, Patricia, I'll send it to you.
Okay, thank you, Dan. So good afternoon, good morning, or good evening, depends where you are in the world. My name is Patricia Verheijden. I'm the curator of interactive experiences in CERN exhibition team. I have a background in scientific research, but about 23 years ago, I moved into science communication and popularization. And 9 months ago, I joined the CERN's exhibition team. We are currently working on the development of the new interactive exhibitions for the new CERN Science Gateway that will open at the end of 2022. Now, CERN is a research institute. It's home to the Large Hadron Collider, which you see behind me. Thousands of scientists and engineers work here doing cutting-edge research and developing the technologies to do the experiments. What not everybody knows is that CERN also organizes several educational activities. There are 2 exhibition spaces, Microcosm and Universe of Particles. Each of them is around 500 square meters, and both under normal conditions are freely accessible. We also have 10 smaller visitor points. They are distributed over the whole CERN site, and they can be visited as part of a guided tour. We also have a space for workshop where we offer students and teachers programs and have extensive material online and on social media. Annually, we have about 150,000 visitors on site who come to visit the exhibitions, the guided tours, the visitor points that are mostly students, groups of adults, as well as individual adults. Now, since the beginning of March, all guided tours have been cancelled. Our exhibitions are closed for the public and all teacher and student programs are suspended. The online activities, however, they have expanded and they have seen an increase of interest and engagement. Since mid-March, almost all people working at CERN are teleworking, and 3 weeks ago we had a gradual restart. That means that each week after following an online COVID-19 safety course, a few more people are allowed on the CERN site. But at this moment, visitors are not allowed yet. For the guided tours, those will restart in October. The teacher program and the studio programs, they also have been cancelled until October, so will restart probably in October. But for the opening of the 2 exhibitions, no date has been fixed yet. It will certainly not be before September. Now, we don't have an opening date yet, but we have a reopening plan ready. That means that all visitors will have to wear face masks, that they will have to disinfect their hands, that we will ask them to do physical distancing. We will offer everybody a stylus to interact with the touchscreens, and we will separate very clearly the entrance and the exit. Our reception area has already been completely transformed with transparent shields between the staff and the visitors. Now, I've been looking around a bit in Europe, what other places are doing. There are big differences between institutions. There are big differences between countries. In some places, reopening started 3 weeks ago. Others are opening this week or next week. For some, the opening will be at the end of June. when I look at the safety measures they are taking, I think everybody is limiting the number of people that can be in the building at a certain moment. Many go for 1 person per 10 square meter. I've heard others say that it's only 1 person per 20 square meter. If there are larger places, they often subdivide their exhibition area in smaller sections, each with a maximum number of people allowed. Of course, everybody is asking for physical distancing. The weird thing is that this depends from country what the safe distance is. It goes from 1 meter to 1.5 meter in Belgium, 2 meter in other countries. Hand cleaning is also something that is always asked, and there is an increased cleaning of exhibits and loose objects. Some ask for face masks, but not everybody is doing this. I also see that many institutions are asking to book online. This involves then specific time slots to enter the building, sometimes also with a maximum duration that people can stay in the exhibition area. Many institutions say it's only possible that you buy your ticket online in advance, but there are a few where you can come the day itself and buy a ticket if there is still capacity available. I hear that one-way routes seem to be quite popular measure also. It's helped to keep the physical distancing, but not everybody's space is suitable to do that. And I've heard that many visitors find it difficult to stick to the one-way. When you look at museums, museums are often reopening without the interactives. With interactives, they refer to touchscreens. But when you look at science centers, often they are not willing to compromise on interactivity. Some of them are thinking about future exhibits and say we will use for screens gesture-based exhibits instead of touch screens, things like that. But many say no, the interactivity is our main core, so we want to stick to this. And in those science centers that are opening or are opening very soon, I hear that most of the exhibits will be accessible when it's about touching and hands-on. But those where you need to crawl in and your whole body, or you have to smell or touch your face, those are closed. Most also seem to have stopped giving shows, demonstration, workshops. Some do it, but only with groups that are already groups, like for instance, a whole family can take part in a workshop. I think the worst situation is for those science centers who are still in an uncertain position, who don't know yet when they can open. So they didn't get a go from their government yet, but that doesn't mean that they don't have a plan ready as soon as they get a go.
It's so true. I mean, there's so much, variation from state, local governments to the federal level, different organizations getting the green light at different times. So thank you so much for sharing some of that background. I'm going to hand it over to Cecilia. Can you talk a little bit about, about the work that you're doing and what your plans look like?
Sure, and good day to everyone, since I know we're at a lot of different time zones, so good day. I'm Cecilia Rakuzek, the President and CEO of the National Czech and Slovak Museum and Library in Cedar Rapids, Iowa. We are a cultural institution with a 5-gallery museum, a large library and archive. And what's unique about us is that we are the only nationally designated Czech and Slovak cultural museum in the country. And this is really our second disaster. In 2008, we were impacted with a devastating flood that our building was covered with 9 feet of water. And so literally we moved the museum across the street and increased the size and did underground parking. So we were very resilient, and we always say that we were stronger and actually better as a result of that. But now this pandemic was something that was not in the plan for any of us. And I have only been here 20 months. My background is academics. I've been a dean, a provost, and a president of a university, and I am Czech and Slovak. So when this position came up, it was kind of a way for me to bring my culture with my academic background. But what's interesting is that I'm a public health person. My background was in public health and health professions, and I taught medical students disaster and emergency preparedness for 14 years of my career. little did I ever realize that I would have to practice what I preach, because the pandemic is one area that we often sort of, talked about, but really did not talk about in depth. And certainly when it comes to collections management, collections accessibility, and certainly the whole operations of a museum, this pandemic has impacted everyone significantly. We plan to reopen on June 15th. We've been closed since March 15th. And when we did close, we immediately enacted, I should say, the incident command system, which is a formal way of really operations during a disaster. And since a lot of us weren't here in 1918, this was an opportunity to really look at a management system of operations in a disaster that is not your typical disaster. So as a result of enacting the incident command system, 5 of us of our staff, our leadership team, came to work every day. We have not missed a day, and practicing social distancing, washing off when we came in, washing off when we went out with hand sanitizers and wipes, and using masks and social distancing. We met every day as an incident management team for 2 hours. And on Mondays and Thursdays of each week, we met with our entire staff using Zoom or GoToMeeting. And so that worked very well in that we could use that time in between to plan what we're going to be doing virtually, how we're going to stay connected to our members, and how we're going to stay connected to our national community. And that was really probably one of the most interesting times for us, because during that time, as a leadership team, the 5 of us, I was the incident commander, we had an operations manager who was our vice president for operations, our development vice president, our fiscal officer, and our facilities director. A pipe broke in the building, a water pipe broke. So that was great. We were very grateful that we were here. And so by having the team here, we were planning for the ongoing operations here and when we were going to reopen. And then we would connect with all staff who were doing programs during the week. And we really increased our online presence significantly. The date 2 weeks ago, the governor of the state of Iowa said that museums could reopen. As soon as that statement came out, we were flooded with calls. Are you going to be open tomorrow? Are you going to be open tomorrow? And we always had 3 criteria that we would use. One was the state public health department and they had said yes. One was the CDC, which again, the large gatherings is something we can't do. And thirdly was the sort of actions of our brother and sister museums in the state. Clearly, we're not all on the same timeline at all. In the city of Cedar Rapids, a town of about 153,000, only 1 museum is opening up earlier than we are. We're going to be the 2nd out of 6 to open up. And so by implementing the incident command system, we really developed some very extensive protocol. And I think they'll even be available. We were happy to share them with you. This is a draft form because as a disaster expert, we don't have a lot of protocol for actually pandemic preparedness, like issues like safety, issues like security, issues like who's going to make sure everybody gets paid if the payroll person isn't there, issues like collections management, and certainly the touching aspects in some of our programs when we do reopen. And so we use this time to really, and I think what's probably interesting about our reopening process are a couple of things. Number one, everyone will be required to wear a mask. And so we used our volunteers in the community to make masks for us, and we will give them to people if they don't have one. And they're very nice cloth masks, and for children as well. So we made sure we had them for children. Number 2, we are going to use plexiglass. We've installed plexiglass at our visitor center and in our store. We've redesigned our large museum store so that we can easily have traffic go in and out of the store, and actually combine some of our merchandise so that people would have easier access to it. We have closed our theater. That was the biggest decision, to close our theater, because all of our seats are cloth seats, and we weren't really sure about the cleaning. So we're going to take our videos that we show and put them in our large auditorium, sort of meeting room that we have that can seat several hundred. And so we're going to take our videos there. Our library will have operational hours that are timed, and certainly we're recommending appointments for the library because a lot of people do genealogy research. March, and we are recommending appointments for that. And then finally, when people come in, I think this is probably the most important, we're asking them a series of questions that relate to where they've been to help in contact tracing. And so we're having them sign in with name, address, and phone number.
Absolutely. You know, it's so interesting to hear. I think you're not in a particularly unique situation in that you weren't really planning for a pandemic. I think most organizations were not, you know, taking steps to prepare for that. But it's really encouraging to hear how you've engaged your community, you know, in the making of the masks and whatnot, and really kind of rolled with, you know, with the changing situation. So thank you for sharing that. I'm going to pass it over to Sabrina here to share a little bit more about what they're doing over in Germany.
Hello, everyone from Germany. My name is Sabrina Benawisha, and I work as a registrar at the German Historical Museum, or the Deutsches Historisches Museum Berlin. For understanding, I will use the German Historical Museum term. I use the English term. A bit to my background, I've got a background in archaeology. I did an internship at the Pergamon Museum with the Ishtar Gate during my studies. Then I moved to London, where I worked at the National Army Museum for a while before I joined the British Museum for about 7 years. There I mainly worked in the on different projects and exhibitions, mainly most important the Germany Memories of a Nation exhibition, where I worked closely with Neil McGregor on it. Afterwards, I moved back to Germany, where I joined the German Historical Museum last October as a registrar for the permanent exhibitions. The German Historical Museum is the main museum in Germany about German history and the largest of its kind. We are based in the old armory of the Prussian army. So very old building, very beautiful building, which tells German history from the Middle Ages to a modern history till today. So currently the permanent exhibition galleries are closed. So in Germany, in Berlin, I have to say, because the difference between the federal state and the regional states, so what the government all over the country implements, as well as the federal states themselves. So in Berlin, all the museums closed and also other cultural institutions closed on 14th of March. The museums sent their staff to work in the home office on the 17th of March till further notice. On the 4th of May, the government decided the cultural institutions can open again, but it was voluntary. So they didn't have to open, but they have to implement the new health and safety measures with the social distancing and the social, the mask and the requirements they have to do now. What happened with us, so with our museum, we have the main building, as you saw on the slide before, and we have an outbuilding which hosts the special exhibitions. We had a massive, very important exhibition planned for commemorating the end of the Second World War on the 8th of May, which was supposed to open on the 26th of March. Of course, that couldn't happen because of the pandemic, which hit us as a surprise like everyone else, I expect. So what happened in the meantime, the museum put in measurements to kind of bring the exhibition still to the viewers and the visitors via sharing it in a digital way, like doing digital tours, doing like, the press department was very into it to make like small short films, connecting it with the theater which we have. We have a cinema housed in the museum, which is closed until further notice, as we have the same with Cecilia. We have like cloth seats, and so we don't know how to keep the social distancing measures in there. So they worked with a local TV station as well and did like kind of guided tours for the audience to keep them going. When the statement came that museums can open again, we decided to open the special exhibition on the 11th of May and use it as a test run. So to see how we can implement the new guidances to a bigger space. And the permanent galleries are still closed, but we're hoping to open them in early July. How are we getting on with that? As you can see, you have to wear a mask. So it's required, you can't enter the exhibition without wearing a mask. You have to sanitize your hands. You have to book a ticket in advance, like a time ticket. So we have time slots, like an hour-long time slots. In the first 2 weeks, we gave out about 40 tickets per hour, which didn't work out for us. So we realized it's not really working out because lots of people came because they were locked in for such a long time. They were really urging going outside, seeing stuff again. What you can see on the next slide as well, we have, hold on, next slide. So we have now a time ticket system for like an hour long. We reduced it to 25 tickets an hour now. The first idea was to give people a 2-hour slot, which didn't work as well because the exhibition is really large. So people spend lots of time in there. We have extra security staff to make sure that they keep on the social distancing measures. And we extended the opening times as well. Usually the exhibitions are open until 6 o'clock, but now we extended it to 8 o'clock. And we have now also a small amount of tickets available for the day. So for the staff, what we do is they have to wear hand and face masks, they have to wear gloves, and we put also plexiglass screens up for the ticket desk to protect our staff behind it.
Awesome. Thank you so much for sharing. And I'm going to pass it over lastly to Michael to share a little bit about what he's seeing over in South Carolina.
Cool. Hey, thank everybody for joining along here. So I'm Mike Scott. I'm down at Red Cliff Plantation, which is one of South Carolina's state park system sites. So park system here in South Carolina had started kind of going through the process in March, talking about COVID, some of the issues related to it, and what kind of the plan was going to end up being for us to respond to it. The numbers escalated quickly. The Park Service broadly ended up deciding to close April 1st, and we remained closed the whole month of April. We give Park Service staff a lot of opportunities to come back to work and able to get a lot of projects done, but at the same time, it allowed us to prepare for the visitors coming in and start establishing kind of some of those initial steps, putting in barriers, trying to figure out where there would be choke points in some of the visitor pathways through the different parks. That's one of the tricky things. I shared with Charity a couple of documents that I'm sure they'll make available through a link or something. One is the standard operating procedure that the park put out when we reopened in May. The other one is going to be the program's draft that we're still developing on how to restart programming. So she just brought a slide there. Some of those were put up ahead of time, specifically the two in the center. There were versions of those to encourage social distancing and reinforce the CDC guidelines, hand washing and hygiene. Those have continued. It's been upgraded with new information. The two on the sides are ones that we've used recently since reopening, kind of as a way to direct more of the revenue and more of the in-person work to online, to try to reduce some of that kind of contact time. Also, the one on the other side there, in South Carolina, the governor decided to institute or at least for a small portion of time, a fairly strong hand on maintaining small group size, and it enabled parks to kind of do that. The trick is, unlike, I think, the other three individuals on this Zoom, we're a park, and so we have extensive grounds that received a good bit of pressure to reopen earlier than maybe most sites would have. We have been allowed to maintain a closed space in a lot of our visitor centers, in the historic structures that are smaller. And again, that's what the program's draft is kind of coming around about. But I know we've got a lot of questions coming up, so I'll wrap this up quickly. But if there's any other stuff that, put it up in the questions and I'll try to answer if you guys are interested in the parks perspective. Out here, specifically, I guess to give you an idea, we've got 4 historic structures, 1 historic mansion, 3 other historic houses, and 369 acres and 1 bathroom. So we've been busy cleaning.
I can imagine that's keeping you busy. Your audio is coming in a little bit jumbled, so if you could come slightly closer to the mic, I think that would be that would be helpful. But we've got We've got, as you mentioned, we've got a ton of questions coming in. So let's start, and I'm going to open this up to all the panelists. So this first question is from Kelsey Edgerton. I'm wondering about visitor evaluation. How do the experience compare with what they expected? Do they feel safe? And how is this data being gathered? You know, for our folks that have already opened up, you want to start by taking this one? I'll let anybody jump in on this. How about Patricia?
Okay, so we're not open yet. We haven't done any evaluation ourselves, of course, but I was earlier in a webinar organized by Excite, where Marie Hobson from the Natural History Museum in London spoke, and they had been doing a lot of research now. And I think in general, people were okay with the situations. I think that people are happy that they can come back to the institutions.
Absolutely. And Sabrina, on your side, how are you handling kind of visitor evaluation? You know, what kind of feedback are you getting?
Well, so far the feedback is very positive. So most of the visitors are happy to implement the new rules and put the mask on and everything. And they're also happy with the time ticketing system. So our staff is doing a great job at the ticket desk and at the entrance to tell the people that these are the requirements. If you're not happy, they had to send a few people away because they said they didn't want to implement them, and they've been sent away, but there was not a big issue about it. And the evaluation, so we kind of count also, they also keep like a tick list to see if there were any problems or how many people actually came in. But it depends on the weather at the moment as well. I mean, at the beginning, lots of people came in, but now when the weather is getting back better, it's getting closer to, it's getting less people.
Absolutely. Cecilia, are you planning to do any type of evaluation?
Well, right. I think our evaluation goes way back to even before opening. What we did to, we made sure that 2 weeks prior to our opening, we've had a lot of media coverage, and we've put up a lot of signs about what's going to be the new norm, or at least for a while. And so our evaluation is going to be an informal evaluation. We've asked the staff to really, the first week that we're opening is for members only. So we're going to use that first week of opening as a trial and evaluate it from our members. And each day then our evaluation is built into our end of day staffing. So we've included now, which we've not done before, is an end of day staffing where we will review how the day went, how the people felt, and if they had any issues, so that the next day we can try to implement it. So in the first week, our evaluation will be a staff evaluation, really more qualitative than anything, and then we'll see how it goes.
Yeah, that's great. And you know, anyone else who has any thoughts on evaluation, feel free to jump in here before we move on to the next question. All right.
We've been
yeah,
just kind of in just general catching the visitors as they're coming through, talking to them. Most of them were initially incredibly happy that the park had reopened, kind of for the grounds and the ability to get out, go for a walk, and easily social distance. Although as we remained open, but the historic structures have remained closed, the number of people asking if we're doing tours again and if you can get inside the house have definitely increased. And they're not always pleased when we say no. So
very true. So here's another great question. This one is from Janice, and she asks, what are people doing to address the needs of visitors with disabilities? Are there any specific tips that you can share? Cecilia, do you want to start off with this one?
Sure. Well, that was a discussion because our education program's really been focused on disabilities throughout our existence, really. And so what we've done is two things. One is it depends upon the type of disability, if it's physical or really genuinely medical, such as a breathing problem. And many times with asthma or people with a heart condition, they cannot wear, or a respirator cannot wear a mask. And so we understand that. And so we're going to certainly ask them to make sure they practice social distancing. There will be Kleenex available, and asking them if they do have to sneeze or cough to make sure they do that. And then we have hand sanitizer placed throughout the building. And And so that we're going to try to, really talk to them, but we're not going to force them to wear a mask, although because we know certain medical conditions. If they have a physical disability, it really should not be any problem, other than to make sure when they come in that they wipe off if they have a walker. We have wheelchairs available already that have been cleaned and sanitized each day. So I don't think that the physical disabilities will be as great of a problem as some of the medical ones.
Absolutely. Anybody else, any of our other panelists want to share anything they're doing around addressing visitor needs regarding disabilities? All right. Another question, this one's from Stephanie Lucas. She's wondering if any of you have research centers attached on campus. What type of access for researchers are being put in place for staff and visitor use? Anybody have research? I see Michael does not, but anyone else?
Well, we have a library where usually researchers can come in, but it's closed until further notice. So we don't know when we're going to reopen that. So because the librarian is still looking into the measurements, what they can do and how they can do the research there. Because with touching the books and having them handed out from the archive, and you have a lot of physical contact because you have to always keep an eye out that they don't take them. So that's something which probably will put into the last consideration because it's also separate from the main building.
Yeah, we have a library and research center. We have graduate students from Europe. Obviously, that's not going to be happening anytime soon. And we're uncertain about with our affiliations with area universities. But we do know that the librarian has requested timed and appointment-only visits to the library. So that we'll see how it goes. And that way we can control the amount of visitors to the library, the contact with the collections, and then the appropriate disinfecting following the visit.
That actually dovetails nicely with another question from Kelly Falcone Hall, and that's how are museums controlling the amount of time guests spend in certain areas of the museum once they're on site? Cecilia, do you want to start off by talking about that?
Sure. What we've done is we basically said to go through the whole museum, the one major gallery and the 5 smaller galleries, it would take about 2 hours. And the first month or so, we're going to evaluate it. We're only at 25% capacity. So that would mean probably only 25 to 30 guests throughout the museum in any one time. So our volunteers are going and our docents are going to be monitoring that and making sure that social distancing. So we feel that every 2 hours we can probably bring in 25 to 30 people. And that's how we're looking at it. We believe, and this is going to be an interesting follow-up, we don't think that many people are going to come the first month or so because all of the studies here are showing that people want to be outside if we have outside events. So we're looking at a major event in August now that would be an outdoor theater in one of the baseball stadiums that isn't being used. So I think that, unless I'm wrong, but I don't think so. 25% capacity every 2 hours.
Awesome. Yeah. Thank you for sharing. And I want to send this over to Patricia. How are you planning to handle kind of the time that guests are spending on site in different areas? How are you going to monitor that?
We're not quite sure yet. Many of the visitors will come in guided tours. That's easy to control. We know when they arrive, we know when they will leave. But of course, there are also walk-ups. We have been thinking about giving people a token that they hand back when they come out so that we can have an idea of the amount of people that are in the exhibition at one certain moment. Because we don't sell tickets, the exhibitions are for free.
Absolutely. And Sabrina, do you want to throw anything in there around the timing of that visitor experience on site?
Yeah, of course. At the moment, as I mentioned before, for the first 2 weeks, we had 40 tickets per hour for the visitors flow, but we realized usually we expected to have more, they don't spend more than 2 hours in the exhibition space. But because the special exhibition has a lot of small objects, has a lot of text, so we realized we have to decrease this, and now it's 25 visitors per hour. So we try to keep a maximum of 65 to 80 people within the exhibition space. How are we gonna do that with a permanent exhibition? We still don't know. So we know that we don't have any group visits. We can't allow any group visits or large groups or school groups. But on the details about it, we don't know yet. So we're still in the process of discussing it, because of course the space is larger, so they can spread it out a bit more.
Absolutely. And I've got a question here. How are you, I want to learn a little bit more about the communication strategy that you're deploying to communicate with your visitors, both before they get there, while they're there, but then kind of after they go home. What kind of channels or methods are you using? Patricia, can you start us off with that?
Well, there is, of course, the website. It's very clearly communicated on the website what the situation is. I think everybody does that. And there is all the social media where we do a lot of communication. I don't think we plan to do any follow-up communication for walk-up visitors, because walk-up visitors, they come, but we don't ask for their contacts.
Definitely. Sabrina, how about on your side? How are you planning to communicate with those visitors?
Currently, we're communicating over the online ticketing system. So when you buy an online ticket, you have all the requirements written on the online ticket. And the same with what Patricia mentioned, the social media accounts are talking about it as well. So, but we don't have follow-ups with our visitors. So we can't take the data, and we're not allowed to take the data, the personal contact details. So we just hope for the best, I have to say.
For sure. And Michael, how about on your side? How are you, what are the different kind of channels of communication you're leveraging?
So Park Service has got a central office communications team that's been coordinating all of that since there's 47 parks, and so they've been tracking capacity. When we did reopen was limited to about 25% based on parking. And so they were tracking regularly which parks had reached capacity, communicating through Facebook and Twitter specifically which parks had closed and when, at kind of set intervals throughout the day. So specifically with us, if we had hit capacity, we would have just contacted them, but we've been slipping under these capacity lines, so it's been easy for us.
And I want to dive into that just slightly. It's kind of a touchy subject, as folks, this is kind of a fairly uncharted territory for a lot of them. So let's say you find yourself in a situation where you are at capacity, and now we need to find a way to articulate to these visitors who have made their way out here, we can't let you in. How do you go about doing that? Can you talk a little bit about that? That's for Michael. Were you able to catch that, Michael?
Sorry, I lost you there for a second. So I will say that the State Park Service has grown very thick skin lately, and has tried to communicate where those channels of communication are. Telling people regularly, please check social media before you head out. Please be aware that things change rapidly and that the decisions are being made both in the interest of the visitors and in the staff. So at the same time, angry people are angry people, and so you just grow thick skin. Learn to calmly but clearly articulate why and move on.
Yeah, absolutely. And any of our other panelists, have you discussed internally with your teams on how to articulate to visitors that you're at capacity? Has anyone else crossed that bridge? Nobody. All right. Well, we'll find out pretty quickly when we get reopened. We'll just have to jump into it. So this is a question from the audience. With facilities that have elevators, how are you going to restrict use to those who require access? Do any of you have elevators in your facilities? Cecilia, you do.
We do, and what we're going to do is we have signage that's going to be posting no more than 3 people on the elevator, and certainly because we are closing all of our entrances to the building except for 2 of them. So one of them is an elevator and the other one is a lot of steps. And so the signage will, and then we have the hand sanitizer right there as well. So certainly, again, there was a question about the lower numbers and people still calling. But when you're used to having 125 people and you even have 3 to 5 calls a day, I don't think that's going to be a major issue. It would be great if I were wrong, but I don't think it's going to be a great issue because of the fact. There was a comment about our restricting it to members. This decision was made already in April, that as we plan to open up, someone thought, is that, something with the times that are going on, that, you know, we're restricting it. No, we thought that if we did it, because of some of the literature going on, that members will give you their honest opinion and be more flexible about some things that may go wrong than the general public. So that was the reason that we have limited the first week to members only to see this. And the other issue is that if we've done any statement about the civil unrest that's going on, actually, yes, we posted because of our mission, and I don't want to get involved in Czech and Slovak culture, but the Czechs and Slovaks have been really leaders in the Velvet Revolution and in the overthrow of communism. So using that, we did use a statement and by Comenius, the father of modern education, about equality, and that has become to tie it into our mission. We're trying to relate everything to our mission. So this opening had nothing to do with our decision about having the members only. It was really a pilot for the members, and that was made in April, that decision.
Absolutely. And, you know, I think that it's so, one of the points that you really hit on there is, so we're going to have a lot more opportunities to maybe create positive visitor experiences. So while you've got maybe the same amount or a slightly reduced staff, you've got a substantially reduced visitor base that's coming through the doors. That breeds more opportunities for one-to-one or one-to-few interactions. And a lot of the studies show that that's one of the biggest drivers of positive experiences in a museum or in a cultural space, is that kind of insider experience when you have a special connection with someone that's there. So that's great to hear that. And one thing I want to put out there too, as we ask these questions, folks that are listening in, you know, in the audience, type in the chat, you know, to share a little bit about what you're thinking about, what your concerns are, how you're addressing certain, you know, certain topics and whatnot. So here's another question. I think a lot of folks are, communication is a huge component of obviously many facets of the experience. Let's talk about signage for a second. You know, how are you all handling signage? Are you putting signs up? What messaging are you using? Let's talk specifics for a second. You know, Sabrina, do you want to start us off with that one?
Yeah, of course, as I showed on the slides as well. So we have signage outside the museum, the exhibition space, and like enough distance to the entrance door, so people don't really have to join a queue if there is one. Signage is written in German and English, both languages. We have signage then on the ticket desk, and it always says like keep it within the exhibition. Then we have always making the measurements to keep 1.5 meters distance. We have the measurements, the signage on the floor to keep the distance and providing the distances. So yeah, we're trying to communicate as much as we can with our visitors through signage in multiple languages.
Definitely. And Patricia, are you putting up signage? And if so, what does that look like?
Yeah, just like Sabrina is telling, posters with what we expect from the visitors. That's probably the main thing. And then signage on the floor.
For sure. Michael, how have you handled that over in South Carolina?
So we were told to kind of create our own signage initially, and that kind of structured, organized signage and graphics would be coming to us. And so those are the ones I shared with you guys on that slide. We've been identifying kind of choke points anywhere that visitors generally pass, parking lot space, outside the restrooms, outside the historic structures. Anywhere that we think somebody might be regularly passing by is where we're trying to place stuff. Yeah, as much as we can and as much as we need. We've identified that fourth one I had on there about picnic shelters was one that kind of had to be created at the last minute, just because there was an identified issue with overcrowding in those spaces. So, you know, you want to have it look good and professional, but at the same time, there needs to be flexibility to make those kinds of decisions.
For sure.
A lot of museums that I've spoken to in Europe have used it as a branding opportunity and done it very much in the tone of voice of the institution. So for English Heritage, which manages a lot of the castles and sort of medieval castles in England, they have two little knights in shining armor with big lances that sort of show the distance. And there are fun ways of doing it, and quite a few museums that I've spoken to have said that they don't want it to be scary. They don't want big sort of red hazard kind of signage. So it's very much about tone of voice to include the visitor in everybody helping each other to keep safe.
Yeah, I love that.
That's the tone we're using. Oh, sorry.
No, go on.
We kind of use the tonage of saying like, look, it's not just for your safety, it's also for our safety, for the safety of our staff and everything. So we kind of keep it very polite and keep it like that we have to look after each other in these times.
Yeah, I love that as kind of an opportunity to, whether it's extend your brand or make light of a difficult situation. There are so many chances right there to kind of let your colors shine. And we see, another example that I've seen of this is with the airlines, how they have to go through the spiel when you get on the plane about how to fasten the seatbelt. And now some of them are making songs out of it and whatnot, just to make it a little bit lighter. So I've got a question that I'm wondering, as all of us are in different phases of reopening, Lizzie started this off by saying, when everyone's got a plan, until you actually go into battle. I'm paraphrasing there. Mike Tyson has a similar quote, not that he's particularly quotable, but and he talks about everyone has a plan until they get punched in the face. So I'm wondering, for the organizations that are in that process of reopening, and let's start with kind of Sabrina and Michael, did your planning match up with the reality? What did you wish that you knew, or what did you find out that just didn't align with how you had planned? Sabrina, do you want to start?
Oh God. Well, of course, we didn't had any ideas how to deal with that situation, but of course we don't know yet. So usually we're a museum mainly focused for school classes and tourists. So we won't have any tourists in the near future probably, or the tourist flows will be limited. So we don't really know how many visitors are coming to visit. And should have been the permanent galleries closed for longer or not? Or should we have used it for like making some refurbishment work within the galleries? So I think we learn a lot like on the go. So like it's like every week we learn something new, we learn something different, we learn a new scenario we didn't expect it or didn't even thought about it beforehand without this situation.
For sure. And Michael, how about on your side? How did things line up, planning versus reality?
Right. So in South Carolina in March, certain businesses were closing either on their own or kind of on the orders of the governor. And so parks actually saw a huge increase in use to the point it was hitting July 4th and Memorial Day weekend numbers. So like really the peak numbers for the entire year we were getting in March because of the lack of other options for people. And when we closed April, we kind of anticipated that May would see those numbers return, and they did. So we knew to anticipate an initial rush. I can say that it's slowly died off very little, but I mean it has dropped some as other spaces and other places have reopened and people have had other outlets. But we were kind of last to close and first to open, and so we were most people's only option to get out of the house.
Absolutely. So I've got a question from the audience here. This is from Tiffany. Any tips or suggestions regarding guided tours and group visit requests? We're not going to offer free public tours for the first couple of months, but what about private tours? What are some ways to handle that? Michael, do you want to start with that? Anybody?
I'll jump on that one. So depending on the group and the private tour and who it is, that's a relationship that the institution, I would think, would have to decide where they're at and where they fall in that. In general, I would think that private tours would almost be easier to control because you would have the ability to make the requirements whatever you need them to be for them to get that tour. So maybe there's galleries you don't enter, maybe there's a limit to the total number that are available for the private tour. Our program we're looking at is a maximum of 10 people total, and that includes any of the staff that would be hosting the program. So if I have one park ranger doing a program, that's only 8 or only 9 participants. If there's 2 rangers, that's only 8 participants. But that's a decision that we've made as a park service to help control and facilitate both for us and for the visitors.
For sure. For sure. Cecilia, can you talk a little bit about how you've handled kind of guided tours and you know the balance between private versus public tours?
Okay. Right now, we're not doing any large tours, although we did get one booked for September from a small community, and we're just going to see what the data looks like in terms of incidence and death rates here. But right now, we're like Michael, if a group of 10, with including us, wants to come through, but we're looking at families only right now. We haven't really gotten any requests to do any others. So we'll see how that goes. And again, we're doing all that contact tracing that we are going to get everyone's name just in the event that something would happen. One of the things that we haven't talked about that we've discussed here a lot is employee concerns and employee safety about returning to work. And we really talked about that a lot here in our meetings. And so what we've done is we make sure that each employee feels comfortable coming back to work. Ironically, about 70% of the volunteers want to come back. The employees, I would say it's probably 80%, but there are some that are fearful. And so we're saying if you can work from home and your supervisor agrees and the work is appropriate, we can accommodate you for now. But we're trying to make them feel as safe and comfortable as they want, but really working it out, because that's going to be a big experience with them in terms of if they're not comfortable, how our visitors are going to feel. So I think that's really important that we get a good pulse of our staff.
Absolutely. Anybody else want to, Sabrina or Patricia, you want to share anything on that?
Yeah, we have suspended any kind of tours until further notice. So until we see how the situation works out. So.
Absolutely. And Patricia, anything else you want to share?
Yeah, also all tours are suspended until October.
Well, so it's definitely going to make for a unique and an interesting experience. You know, when you take the tour component out of that on-site experience, I think there'll be a lot of learnings that are going to happen in these early days when organizations reopen and start to just kind of figure a lot of things out on the fly. So we have about 3 minutes left, and I've got a question that I want to ask all of our panelists. And what is one piece of advice or a recommendation or a learning that each one of you have had that you'd be willing to share with the audience to, just some words of wisdom as we break for the day? What's a piece of advice you would give them that they can bring back to their organization? Patricia, can you start us off?
It's maybe what somebody from a German museum said. Many people are now freaking out about interactive exhibits and about touching things. And should we touch? But people go on the bus and they buy a ticket on the bus and they touch the handle of the door in the shop and stuff like that. So people are touching things in many different other places. So why shouldn't they touch anything in a museum? I thought this was a very interesting point that he was making.
Okay, interesting. Sabrina.
Yeah, I would like just to give a piece of advice of saying, don't forget your staff at the front lines, like the people at the ticket desk, the people at the security guards who are guarding the exhibition spaces, because they are the ones who are working close with the visitors and taking most of the abuse as well when someone is frustrated because they can't get in, because they have to wear a mask, because it's too crowded for them and they've been reminded to keep the distancing. And they're the ones who are doing most of the hard work and most of the time the least appreciated people. So just show more to appreciation of the people who are actually really facing the audience.
It's definitely going to be a difficult situation to be in, where in reality, those front desk staff are the messengers and just trying to get the point across. And unfortunately, I think in some instances might be lightning rods, but hopefully far and away the general public will understand. Cecilia, what do you have for some words of wisdom?
Well, I think probably the best words of wisdom I can say is that we're writing history from the emergency perspective, and to make sure that you document all your best practices, because We really have not had this kind of disaster to deal with before in the last 100 years. And I take the word PPE, the protective equipment, and I put 3 different words to it. I put prevention, patience, and energy. We need a lot of energy to get us through this. So I take the PPE and I have converted it to patience, prevention, and energy to get us through this and document to make history.
I love that. Yeah, absolutely. And Michael, are you still there? If you can share some words of wisdom. Looks like we lost Michael. Charity, Zinnia, Lizzie, anything you want to share?
No, I think Cecilia hit the nail on the head with just being patient and flexible going into this. You know, we've talked about how many Zoom calls we've all been on. Just think of that number when you think of the number of plans you'll run through and situations you'll come up against. So,
absolutely.
I would just say for those who are in leadership positions in the organizations, really take the pulse of your staff. When I was leading at the Gibbs Museum of Art, I mean, that's a staff of only about 20, but there were varying degrees of anxiety about returning to work and what that would look like. And people have individual concerns. So as a leader, it's challenging because you want your staff back intact, but another organization I'm with right now is encouraging everybody to work remotely as much as possible. So it's such a difficult balance, but I would just keep that in mind, the self-care aspect of all of this in terms of returning.
Absolutely. And Lizzie, take us home.
Well, I think we've all learned a lot, and there is a lot to learn. And I think we should check in after some of the museums have opened and share more of the ongoing useful tips and tricks. And I think following up with written, sort of tips and tricks, even if it's just one sentence, can actually make a big difference to someone who hasn't been through it yet.
Absolutely. Well, thank you to Charity, Zinnia, and Lizzie for having me today, and all of the panelists. Some fantastic insights. We're all in this together, even if we're in it in different phases. So just want to say thanks for sharing your insights, and to all the folks that have tuned in, stay safe. Good luck with your reopenings, and we'll be in touch. There will be a recording of this webinar. You can contact Charity, Zinnia, or Lizzie for that recording, and we hope to see you soon.
Thanks, Jan. Great job.
Stay safe.
Thanks.
Take care.
Thanks all.
Everyone.
Take care. Bye-bye.
Bye.